Hello, very good morning, everyone. It gives me a great pleasure to introduce Dr. Wong Kau-hui, the speaker. Dr. Wong Kau-hui is a senior medicine in Malaya. She received a bachelor's of science in biotechnology, honors with a distinction in 2003, and followed by masters of science, also with a distinction in 2007, and a PhD in human and animal physiology in 2011 from University of Malaya. She is currently serves as an editorial board member of BMC, which is a complementary medicine and therapist. She also is a guest associate editor of Frontiers in Pharmacology, guest editor of Cells, sub-editor of Journal of Health and Translational Medicine for JUMAC, Malaysia. And at the department level, she also is a coordinator for postgraduate research program. And she's a life member of Malaysian Anatomical Association and also former treasurer of MAA from 2015 to 2021. Dr. Wong has an excellent track record for research. Her research focuses on using alternative medicine, in particularly the culinary and medicinal mushrooms cultivated in Malaysia, for neuroprotection and neuroregeneration in the cellular as well as the animal models. She conducts basic science research on hereditary ataxia, the Friedreich ataxia, and spinocerebellar ataxia type 3, or also known as SCA3. Alternate medicines, it's another way, it's another approach, probably which can help disorders. So without Dr. Wong Kau-hui to give her talk. Dr. Wong?
Thank you, Prof. Murali, for your kind introduction. Dr. Murali was also my PhD supervisor.
Thank you, Dr.
Okay, let me share my screen. Good morning, everyone. Thank you, Prof. Murali. The title of my presentation is Productive Effects of Hericium Erinaceus Mushroom Against Oxidative Stress in Friedreich's Ataxia. My name is Kau-hui. Friedreich's ataxia, or FRDA, is a genetic ataxia that belongs to the subtype of autosomal recessive cerebellar ataxia. And the cases of FRDA have been reported in Europe, Middle East, North Africa, and India. So the prevalence of FRDA is estimated to be at 1 to 2 cases in every 50,000 populations. So back to Malaysia, there was one case reported by Spacey and co-workers in 2004 involving 2 Malaysian siblings aged 9 and 10 with a mutation in the frataxin gene and a deficiency in the complex 1 of the electron transport chain. So FRDA is usually diagnosed during the childhood, and within 10 to 15 years, the patient will be wheelchair bound. The clinical manifestations include scoliosis, loss of reflex, sexual dysfunction, difficulty in swallowing, diabetes, and patients are at high risk of developing cardiomyopathy that results in premature death. FRDA is a mitochondrial disorder. So accumulating evidence have shown that mitochondria is greatly impacted in FRDA. Jocelyn Richardson and co-workers in the early 2000s pioneered the mitochondria study in vitro model using FRDA fibroblasts from the FRDA patients. Subsequently, Abati and co-workers in the early 2010s investigated the mitochondrial depolarization and impairment of mitochondrial biogenesis in transgenic mice model of FRDA. So these are the YG8R and Kiko mice models. We propose the use of Hericium Erinaceus, a culinary and medicinal mushroom native to the North America, Europe, and the Oriental countries. So this is how the mushroom looks like. It is cultivated in our country in several locations. So these photographs of Hericium Erinaceus was captured at Genting Sempah, Pahang. So it looks like the monkey's head. So that's the reason we also call it as monkey's head mushroom, lion's mane, bear, or even the lobster, because it's the fleshy mushroom. So in this study, we used the dietary supplement from Hericium Erinaceus, marketed in Malaysia. So our previous studies have shown the anti-neuroinflammatory, neuroregeneration, and neuroprotective effects of this mushroom for the past 15 years. So the current therapeutic strategies for FRDA is aimed to manage the FRDA, but not for the treatment. So FRDA patients are currently receive palliative care instead of the proper treatment. So we aim to develop a safe therapeutic agent that could manage the FRDA. So we had two specific objectives for this study: to isolate and to identify the compounds of Hericium Erinaceus, and to assess the regulatory effects of Hericium Erinaceus on mitochondrial function and biogenesis in vitro model of FRDA. The Hericium Erinaceus mushroom dietary supplement was obtained from Ganofarm R&D Sendirian Berhad based on the Memorandum of Understanding and Memorandum of Agreement. The mushroom was subjected to ethanol extraction. The extract the compounds, the fractions were obtained based on two methods: gel permeation chromatography method and the preparative radiochromatographic method, to yield 10 to 13 fractions. These fractions were then purified by the PRC method. And again, we also employ the spectroscopic methods to identify the major compounds in the mushroom. So these are the methods: the NMR, HRESIMS, UV, and the IR. As for the FRDA cells, we obtained the cells from Korea Institute for Medical Research, USA, based on the material transfer agreement. We obtained the dermal fibroblasts from the disease patient, the FRDA patient, and also the normal fibroblasts. So these fibroblasts look similar under the microscope, but the FRDA fibroblasts are prone to oxidative damage once we apply the oxidative stress inducer, a chemical known as L-butyronine sulfoxamide, in short, LBSO. So moving on to the methodology. Okay, so these are the parameters that we employ to study the protective effects of Hericium Erinaceus mushroom in FRDA: the MTT viability, endogenous antioxidant activity, LDH release, ROS. As for the mitochondrial function, we look at aconitis as well as the results were compared to the positive control, which was the 5 macromolar idebenone. So this is the oxidative stress inducer, L-butyronine sulfoxamide, or LBSO, that can reduce the level of glutathione, an endogenous antioxidant, mimicking the pathogenesis in FRDA. Results and discussion. So these are the 3 major compounds isolated from the Hericium Erinaceus: the adenosine, heron 3, and heron 4. Adenosine is a well-known neuromodulator that promotes the release of neurotransmitter from the synaptic vesicles. On the other hand, herin 3 and herin 4 are the novel compounds. So there's no report on the medicinal aspects of these two compounds. So this is the flow of the purification and the isolation of major compounds from Hericium erinaceus. Before we perform the study, mitochondrial study, we estimate the concentration of LBSO to be used in this study. So we found that 12.5 millimolar of LBSO significantly reduced the cell viability compared to the normal fibroblasts. So as I say, the FRDA fibroblasts are susceptible to oxidative stress. So you may see that at this concentration, there's more the cell debris. So on the other hand, the normal fibroblasts still display the spindle shape of the cells. So this concentration was used in the subsequent assays of oxidative stress. As for the Hericium Erinaceus mushroom, we found that 1 to 32 milligram per ml did not cause any cytotoxicity effects in both cells. So this range of concentration was used in our study. So we found that 32 milligram per ml Hericium erinaceus significantly increased the cell viability as compared to the LBSO. So this is based on the LDH release lactate dehydrogenase enzyme as a measure of the apoptosis. As for the RS release, we found that the same concentration reduced the RS level significantly as compared to the LBSO. In terms of endogenous antioxidant protein and enzymes, the same concentration of mushroom also increased the glutathione, GPX, glutathione peroxidase, SOD, superoxide dismutase, and the catalase activity significantly compared to the LBSO. So these endogenous antioxidant enzymes can neutralize the free radicals. For the mitochondrial study, we employed one of the major inosine because we found did not have any significant effect on the mitochondrial function and biogenesis. Therefore, we use the adenosine, one of the major compounds. We check the viability. We measure the toxicity effect of adenosine on these cells, and we found that 200 to 800 micromolar of adenosine did not cause any cytotoxicity effect in the fibroblasts. So this range of concentration increased the mitochondrial membrane potential, MMP. MMP is the electrochemical gradient of protons generated in the inner mitochondrial membrane that could drive the synthesis of ATP. So in line with this finding, we also observe an increase in the ATP level significantly compared to LBSO, as well as the aconitase enzyme activity. Aconitase is an enzyme of the Krebs cycle. As for the mitochondrial biogenesis, we use a kit. So this kit measures the SDHA to COX-1 ratio. SDHA is a subunit of complex 2. COX-1 is a subunit of the complex 4. And we found an increase in the ratio for the adenosine. Okay. So these findings are again supported by our observation in the modulation of gene expression of transcription factors. So we found that NRF1 and the TFAM regulated the gene expression of the endogenous antioxidant enzymes and proteins. this is to counteract the oxidative stress. So taken together, Hericium Erinaceus attenuated an increase in the ROS, attenuated a decrease in the membrane integrity, attenuated reduced level of mitochondrial membrane potential upon administration of LBSO. So LBSO is the oxidative stress inducer that could decrease the level of endogenous antioxidant enzymes. So our current knowledge is still limited by how the iron sulfur cluster biogenesis is being regulated by this mushroom. So this would be our future study, okay, to look at the biogenesis of the iron sulfur cluster. So these effects are actually regulated, okay, by the nuclear transcription factor, NF2 and NF1, and the mitochondrial transcription factor, the TFAM. So subsequently, this leads to attenuation of oxidative stress-induced cell death. So in conclusion, the three major compounds can be developed as mitochondrial targeted compounds in the management of FRDA. And managing FRDA is a multidisciplinary efforts involving the scientists, the R&D, patients and the caregivers, health professionals, and even of all of these societies. Presentation, thank you.
Okay, Dr. Wong, thank you very much. Any questions for Dr. Wong? I think there is one in the chat by Wu Quan Chan. I notice in most mitochondrial diseases, certain tissues or organs are affected more than others. Is the mitochondria in all the tissues of an affected patient not the same, or should they not be affected to the same extent? YK Chan. Dr. Wong, you want to answer that?
Yes, thank you, Prof. Thank you, Dr. Chan. Yeah, mitochondria is impacted in FRDA. We have not done any in vivo study or the animal studies, but the cardiac muscles mitochondria is impacted because, as I said, patients at high risk of developing cardiomyopathy. Yeah, so that results in a premature death. So we'll be studying the mitochondria extensively, yeah, probably in the transgenic mice model. But at this moment, we do not have any data whether which tissue has more damage compared to the others.
Okay, thank you, Dr. Wong. And the next question, very nice to see from Prof. Tengku Sarah. Her question, this seems like a breaking work, well done. If it is a modulating neuronal stress, can I say it may be helpful for dementia? Dr. Wong, want to answer?
Thank you, Prof. Sarah.
Yeah.
Any natural product with the anti-neuroinflammatory effects would have positive effects in the mitigation of oxidative stress in neurodegenerative diseases. So we actually have reports on the in vivo study of the Alzheimer's disease using this mushroom. Yeah, even Prof. Murali has also done some research in the Hericium Erinaceus. So yeah, Prof. Sarah, yes, I would say yes for preclinical studies. So we have not performed this on the human, so we do not have any data for that. Thank you, Prof.
Okay. Now the next came from Kamala Kannan. Heavy metal and EMG has it any effects in the mitochondrial damage? Heavy metal EMG.
EMG stands for. Sorry, Prof. Kamala. EMG stands for. May I ask what is EMG?
Kamala Kannan, are you there? Would you like to ask directly?
In this study, we use only the LBSO, L-butylene sulfoxamide. So it is a neurotoxin. So if you're asking me whether heavy metal, I'm sure it is, but I did not do any study on the heavy metal, on the mitochondrial damage.
Okay. The next question, also from a Prof. Tanku Sara. What further studies should be take a sum of this? Which form can we take? Dr. Wong?
Yeah, okay, thank you, Prof. Sara again. Okay, 15 years ago, we tried with the fresh mushrooms. So it was laborious to actually obtain the extracts. So after 15 years, the company actually developed this dietary supplement approved by the KKM. So we actually have this dietary supplement of Hericium Erinaceus marketed locally. So there's a specific dose where healthy subjects and also the patients with dementia can try. But again, we also need the proper human trials. Yeah. So, Prof, you're asking which form can we take? That would be the water extract. So actually the dietary supplement is prepared by using water extraction. Yeah. So this is a safe type of dietary supplement that we can take.
Okay, right. The next question is from David. Has this been investigated in the context of ALS/MND?
Thank you, Dr. David. No, this has not been investigated on the ALS or motor neuron disease. Yeah.
Okay, and now Kamala has responded. EMG refers to electromagnetic fields. Let me go back to the question. Heavy metal and electromagnetic, has it any effect on mitochondria?
Okay, thank you, Dr. Kamala. So, yeah, heavy metal and electromagnetic fields. We actually have not performed such an extensive study on the heavy metal and EMG yet. Yeah.
Okay. The next question is the ingredient from Yu Quen Chan. Is the ingredient you pointed out only limited to the strain of mushroom you studied, YK Chan? Dr. Wong?
Okay, thank you, Dr. Chan. Yes, the three major compounds were isolated from the mushroom. As for other types of mushroom, they do have their own major compounds. But as I said, this also needs extensive chemical studies to look at it. But I believe adenosine usually present in several types of mushroom, not only the Hericium erinaceus, the adenosine. So as long as that mushroom can promote axonal growth or the neuronal growth, so I believe that adenosine can be also isolated from that type of mushroom. So for the moment, we focus on this Hericium erinaceus with these three types of the major compounds.
Okay. Now, any other questions from anyone?
Dr. Chan also saying maybe a collaborative effort with the nutritionist.
Yes, yeah.
Yeah. Thank you, Dr. Chan.
Okay. Any other question for Dr. Wong? End of the talk. So I must say Dr. Wong has done very good study and we wish her all the best, and also thank you so much for sharing very detailed scientific research from her results this section. Okay, thank you so much, Dr. Wong.
Thank you, Prof. Murali, for moderating this session. Thank you, FOM, and thank you to all participants for the inputs that could improve this study further. Thank you.
Okay, thank you, Dr. Wong.